So in this session, let me discuss the multiple choice questions in the topic of the mitral stenosis. The next question is, you see a 57-year-old woman who presents with worsening shortness of breath coupled with decreased exercise tolerance. She had rheumatic fever in her adolescence and suffered from the essential hypertension. On examination, she has signs which points to the diagnosis of the mitral stenosis. Which of the following is not the clinical sign associated with mitral stenosis? The options are malar flush, atrial fibrillation, pansystolic murmur which will radiate to the axilla, tapping undisplaced apex beat, right ventricular heave. So, in case of mitral stenosis, you will have malar flush, right? See, the differential diagnosis for your malar rash of systemic lupus erythematosus is malar flush of mitral stenosis. Then atrial fibrillation can be seen in case of mitral stenosis. Why? Because there is enlargement of the left atria. So this distended left atria will be arrhythmogenic, where the individual will have atrial fibrillation, and because of this atrial fibrillation they will have the palpitations. Okay, and pansystolic murmur which radiates to the axilla is not the feature of mitral stenosis. This is the feature of the mitral regurgitation. So mitral regurgitation murmur is best heard at the apex, and that will be radiating to the axilla. And which particular leaflet will have a prolapse in order to have the murmur to radiate to the axilla is the anterior mitral leaflet. So if anterior mitral leaflet prolapses causing your mitral regurgitation, the murmur will radiate to the axilla. And if the posterior mitral leaflet abnormality is there causing mitral regurgitation, the murmur will be radiating to the base of the heart in case of mitral regurgitation. Okay. Then tapping undisplaced apex beat, that is what you see in patients with mitral stenosis, and right ventricular heave can also be seen in patients with mitral stenosis. And why is this? That is because of the pulmonary hypertension. Right, that is because of pulmonary hypertension you have this particular right ventricular heave, because once there is pulmonary hypertension there will be increased afterload on the right ventricle. So once there is increased afterload on the right ventricle, there will be right ventricular hypertrophy, right? There will be right ventricular hypertrophy, and because of this particular right ventricular hypertrophy you have this particular right ventricular heave. Okay,